disability inclusion strand is a very important wraparound strand within the My First 1000 Days project. And we're concerned about inclusion in 5 key ways. First of all, ensuring that disability inclusion is built into the design and delivery of the Leeds centering-based group care programme as a whole. Secondly, ensuring that our centering-based group care programme meets the needs of pregnant disabled people. Third, ensuring that the programme is designed in ways that meets the needs of disabled infants and their families or those providing care to them. Working with disabled parents, this is the 4th point, and disabled families to co-produce a disability inclusive model of centering-based group care. And 5th, connected to that, centering parents' and families' views, their experiences, their expertise, but also combining that sensitively and ethically with the perspectives of significant others. And by that, I mean professionals in the helping professions, for example. So why does this work stream matter? Why do I feel it matters? Well, the bottom line is because we know that current service provision is not always meeting the needs of disabled families. And this is a matter of human rights, but it's also a matter of human dignity and flourishing. And let me unpack that a little bit. First, it matters because we know that pregnant disabled people are not always receiving the high quality health and social care that is their right and that they deserve. In fact, research conducted in the United Kingdom and globally highlights that good practice is possible and that good practice exists regarding prenatal and postnatal support for disabled people who are pregnant. But unfortunately, this research also highlights that there is an array of challenges and barriers that these parents encounter, including inaccessible locations, insufficiently inclusive models of care, lack of suitable information and timely information, and finally that staff are not always sufficiently knowledgeable about the needs of these parents and families, and sometimes even hold some negative attitudes. And as a result, disabled people who are pregnant are not always receiving the high quality, respectful and dignified services and provision that is their right. Second, contrary to the beliefs of many within our disabling societies, families of disabled children often contest the idea that the birth of a disabled child is tragic for the child and for the family, or that having a disabled child is somehow an unbearable burden. But they do point to the many, many barriers that they face: physical inaccessibility, economic barriers such as poverty, and social and cultural barriers, the attitudes of other people, in other words. And these barriers act upon the health and well-being of disabled children and their families in really deleterious, damaging ways. So disability studies research has documented how isolated these families often feel. Sadly, some groups of disabled children, especially those with learning disabilities, are more likely to experience health inequalities associated with preventable environmental determinants. And disabled children are also at significantly greater risk of being abused or neglected. And these inequalities and failures in existing support for disabled families are of course a matter of human rights, human dignity and flourishing. When we fail to guarantee disabled children and disabled people access to high quality, inclusive health and social care services, we're failing to ensure their human rights. And I think at this point it's really important that we remind ourselves that the UK has both signed and ratified the UN Convention on the Rights of Persons with Disabilities. Governments need also to take all necessary measures to ensure the full enjoyment by disabled children of all human rights and fundamental freedoms on an equal basis with other children. And they must ensure that disabled children and pregnant disabled people receive the same range, quality and standard of free and affordable healthcare and programmes as provided to other persons, including, and this is important for our project, in relation to public health programmes, because My First 1000 Days is an example of such a public health programme. So, to return to my question, why does this work stream matter? It matters first morally and ethically, because there are injustices here that are in need of remedy. And secondly, it matters legally, so that we're in alignment with the UN CRPD and the UK Equality Act. Now, in terms of the research context and how we will be contributing to that, we will be focusing on researching inclusively, actually conducting this project in an inclusive way, in the spirit of nothing about us without us, which is one of the famous slogans of the disabled people's movement globally. To date, we know that there has been insufficient research and innovation in the area of support for pregnant disabled people and disabled infants. This may seem surprising, but it's true. It's a neglected area. So it's thus very important that the First 1,000 Days project will develop and seek to develop a model of group care that seeks to break that vicious cycle of poor quality and inadequate or insufficiently coordinated service provision by offering a care that enhances the health and well-being of children and parents holistically. And the objective is to empower parents. So this strand of work will ensure that the model of group care developed helps ensure the very best start of life for all children and alleviates as many as possible of the pressures faced by disabled families. And I'm very pleased that the approach we're going to take is that of co-production. So what I will be doing together with my colleagues will be to work with disabled parents and families of disabled children in the spirit of nothing about us without us to develop together a vision, a blueprint for a disability inclusive model of group care that builds on the best of the existing support services and mechanisms and seeks to address any gaps in current provision. What will we be doing practically? Well, we'll be running design workshops with disabled parents, disabled adults and young people, plus some professionals in the field to look at the centering model of group care, understand it, think about it, consider how it can be made inclusive, and then developing a blueprint for an approach to integrated health and social care that supports disabled infants and their families. I'm really looking forward to being part of this project, working with families and with my colleagues, because I'm sure together we can make a positive difference.